Hi, this is Kendrick Johnson with themedschool.com. I'm a third-year medical student at Toro University, Nevada, and this video is intended to be a review for USMLE Step 2, and we are going to go over pericarditis, pericardial effusion, hemopericardium, and cardiac tamponade. So pericarditis is the most common problem that you can have with your pericardium. So just as a refresher, the pericardium is kind of that sac that encloses the heart. And pericarditis is any inflammation of that sac. So what kinds of things cause inflammation? Well, lots of things do. Any type of infection, which is going to be probably your most common cause of pericarditis. So viral infections, bacterial infections, TB. And one that you're likely to hear a lot about on the boards is Dressler syndrome, which is going to happen a couple weeks after somebody experiences an MI. So as we get a little bit later on, we'll talk about the presentation of pericarditis and keep that in mind with a post-MI patient. So cardiac surgery or any interventional procedure or trauma, so basically anything that's getting in there and messing with the heart, the pericardium, and anything that's in that area. You know, the heart is surrounded by the lungs, the esophagus, so anything in there could be a potential source of inflammation. So autoimmune diseases like lupus, and including drug-induced lupus, so remember procainamide and the others that cause drug-induced lupus. And then uremia, dialysis, hypothyroidism, and lung, breast cancer, Hodgkin's lymphoma, and mesothelioma. And then a lot of these are going to be idiopathic. So they're going to come in with a history of recent infection or an MI or trauma or surgery. A lot of times it's going to be in an upper respiratory infection that they had, a couple weeks ago. And they'll have this positional retrosternal pain. So this is the same area where you might feel an angina or an MI, but it feels different according to pericarditis patients, and it also will be somewhat relieved by sitting up and leaning forward. And it's not going to be affected by exercise or food, so you can, in that way, kind of rule out angina and GERD. So if somebody comes in with this chest pain, of course you're going to work them up for any type of heart pathology. So you're going to listen to the lungs, or you're going to listen to the heart and the lungs, and you'll hear a pericardial rub on exam. You can go to YouTube and look up what that sounds like. And then EKG, like we have here on the right, shows ST elevation in all leads. So we know that other cardiac pathology causes ST elevation. But then we're going to do an echocardiogram. And that's how we confirm the diagnosis. So in order to treat pericarditis, if it's a viral pericarditis, all we've got is NSAIDs. We just want to reduce the inflammation, and of course, bacterial pericarditis we'll give antibiotics for. And then in some cases, they do a pericardectomy if it becomes a recurrent problem. So moving on to the next pathology of the pericardium, we're going to talk about cardiac tamponade. And this is somewhat related because pericarditis can cause pericardial effusion, which can lead to cardiac tamponade. So tamponade is just the compression of the heart caused by the accumulation of fluid in the pericardium. So if the heart is getting compressed, it's obviously not going to be able to expand to fill and to have the same amount of cardiac output. And the two major causes are effusion and hemopericardium, or blood in the pericardium. So the pericardial effusion can be caused by pericarditis, but it can also just be any systemic edema. So different types of shock can cause it, or hypertension. Other things that can cause edema can be associated with pericarditis. And then hemopericardium, usually we're going to have something sharp sticking into your chest, or something hitting your chest really hard. But metastatic cancer or infections can cause hemopericardium as well. And the classic presentation of cardiac tamponade is Beck's triad. So you have distant heart sounds, distended jugular veins, and hypotension. And also you're going to have Pulsus Paradoxus. So you're going to want to check the blood pressure on inspiration. They call it Pulsus Paradoxus, and I've spelled it wrong here, but they call it Pulsus Paradoxus, but it's not really paradoxical in that that's what happens on normal inspiration, is that you have a fall in blood pressure. But the difference is that it's an increased change in blood pressure on inspiration, so over 10 millimeters. And then electrical alternans is just when you're looking at the QRS complexes, some of them are taller than the others. And here on the right, I've got a picture that I thought would be most helpful if it was in Russian, so I translated that for you. And the treatment of cardiac tamponade includes immediate pericardiocentesis. And again, there's good YouTube videos to look up how to do that. But basically, we're just letting all the fluid drain out of the pericardium. If it's not quite a tamponade, but you do have effusion or hemopericardium, then you can just work on treating the underlying condition, and the fluid will resolve itself in some cases. But if it's tamponade, if we're getting the Pulsus Paradoxus, electrical alternans, and Beck's triad, then it's time to do pericardiocentesis. So the images used here, including our Russian image, were found on Wikimedia Commons, and they have a Creative Commons license, so you can use them if you need them. And please email me at kendrick@themedschool.com if you have any suggestions for making it better, or anything that I didn't include that I should have. Or you can leave a comment below the video. Thanks.